Movement on the trunk and spine. Joint classification, trochoid or pivot. Articulations, body, intervertebral disc, transverse process, and spinous process of the spine. For the movement in the stance phase, we have hip extension, external rotation, extension, flexion, plantar flexion, eversion, and lateral flexion. The agonist muscles activated are semitendinosus, semimembranosus, bicep femoris, and gluteus maximus. The contraction type is isometric and concentric. In the prep phase, we have internal rotation, flexion, external rotation, flexion, plantar flexion, eversion, and spinal rotation to the left, as well as slight flexion. The agonist muscles activated in this phase are semitendinosus, semimembranosus, gluteus medius and minimus, iliopsoas, rectus femoris, sartorius, pectineus, as well as the peroneus longus, peroneus brevis, and peroneus tertius. Also, there are the rectus abdominis, external oblique abdominal, transverse abdominis, longissimus capitis, obliquus capitis superior. Lastly, the contraction type in this phase is concentric and isometric. In the movement phase, we have hip flexion, slight internal rotation, extension, flexion, and plantar flexion. For the muscles, we have the iliopsoas, rectus femoris, sartorius, pectineus, and tensor fasciae latae. The other muscles also activated are the rectus femoris, external obliques, transverse abdominis, longissimus capitis, oblique capitis, and superior. The contraction type are concentric and isometric. In the follow-through phase, we have horizontal adduction, hip extension, flexion, dorsiflexion, plantar flexion, rotation to the left, and lateral flexion. The agonist muscles in this phase are the rectus capitis, capitis lateralis, sternoid clidomastoid, longus capitis, gastrocnemius, soleneus, tibialis posterior, peroneus longus, and peroneus brevis, as well as the tibialis anterior and peroneus tertius. In this phase, we have a contraction type of eccentric to concentric and isometric.
This is Christopher Cervantes. I'll be talking about the hip joint. Joint classification is acetabulo-femoral joint. Articulations are pelvic girdle, ilium, ischium, and pubis and femur. In the stance phase, left hip, the action is external rotation. Agonist muscles are piriformis, gillimus superius, inferior internus, arbitrator internus and externus, quadrator femoris. The contraction is isometric. In the right hip, action is hip extension with agonist muscles, semitendinosus, semimembranosus, bicep femoris, gluteus maximus. Contraction is isometric. Preparatory phase. The left hip, action is external rotation. Agonist muscles, piriformis, gimbalus superius, inferior internus, arbitrator internus, and externus, and quadratus femoris. Contraction is isometric. On the right hip, the action is internal rotation with flexion. Agonist muscles, semitendinosus, semimembranosus, gluteus medius and minimus, iliopsoas and rectus femoris, sartorius and pectineus. Contraction is concentric. Movement phase. Left hip action, slight internal rotation, agonist, iliopsoas, sartorius, pectineus, adductor brevis, longus, mangus, and gluteus maximus. Contraction, concentric. Right hip action, hip flexion, agonist muscles, iliopsoas, rectus femoris, sartorius, pectineus, and tensor fascia latae. Contraction is concentric. Follow through phase. Left hip action, hip extension, agonist muscles, semitendinosus, semimembranosus, bicep femoris, and gluteus maximus. Contraction is concentric. Right hip action, horizontal adduction, agonist muscles, abductors, gluteus medius, minimus, tensor fascia latae. Contraction eccentric.
This is Tyler, and I'll be talking about the knee joint. So the joint classification is the gingivalis or hinge joint. The articulations are the femur, patella, and the tibia. The stance phase in the left knee is going to be action, flexion, and external rotation. The agonists are the semitendinosus, semimembranosus, biceps femoris, sartorius, and the popliteus. And the contraction is isometric. And for the right knee, the action is going to be extension. Agonists are vastus lateralis, intermedius, and medialis, along with the rectus femoris and the sartorius. And the contraction on the right knee will be isometric. For the preparatory phase, the action on the left knee is going to be flexion. The agonists are semitendinosus, semimembranosus, biceps femoris, sartorius, and the popliteus, and the contraction is isometric. And then the action on the right knee is also flexion, and the agonist semitendinosus, semimembranosus, biceps femoris, sartorius, and the popliteus, and the contraction on that knee, however, is concentric. And for the movement phase, the left knee action is going to be flexion. The agonists are semitendinosus, semimembranosus, biceps femoris, sartorius, and the popliteus, and the contraction is concentric. As for the right knee, the action is extension, and the agonist for that is going to be the rectus femoris, vastus lateralis, intermedius, medialis, and the sartorius, and the contraction is also concentric. Lastly, the follow-through phase. For the left knee, the action is flexion. The agonists are semitendinosus, semimembranosus, biceps femoris, sartorius, and the popliteus, and the contraction is concentric. And for the right knee, the action is flexion. The agonists are rectus femoris, vastus lateralis, vastus intermedius, and the vastus medialis, and the contraction is eccentric.
Okay, today we're going to be discussing the ankle joint, the joint classification of the gingivalis or the hinge, the articulations of the tibia, the fibula, the talus, the calcaneus, the navicular, the cuboid, three cuneiforms, the metatarsals, and phalanges. For the stance phase, the left ankle, the action is eversion and plantar flexion. For the agonist, it's peroneus longus, peroneus brevis, and peroneus teres. The contraction is isometric. For the right ankle, the action is plantar flexion. For the agonist, it's going to be the gastrocnemius, the soleus, the tibialis posterior, the peroneus longus, and the peroneus brevi. The contraction is isometric. For the prep phrase, the left ankle is going to be eversion and plantar flexion. For the agonist, it's going to be peroneus longus, the peroneus brevis, and the peroneus teres. For the contraction, it's going to be concentric. For the right ankle, the action is plantar flexion. For the agonist, it's gastrocnemius, the soleus, the tibialis posterior, the peroneus longus, and the peroneus brevi. The contraction is concentric. And for the movement phase, the left ankle is plantar flexion, the agonist is gastrocnemius, the soleus, the tibialis posterior, the peroneus longus, and the peroneus brevis. The contraction is concentric. For the right ankle, the action is plantar flexion, the agonist is gastrocnemius, the soleus, the tibialis posterior, the peroneus longus, and the peroneus brevis, and the contraction is concentric. And for the follow-through phase, the action is plantar flexion for the left ankle. For the agonist, gastrocnemius, the soleus, the tibialis posterior, the peroneus longus, and the peroneus brevis. The contraction is concentric. For the right ankle, the action is dorsiflexion. For the agonist, it's going to be the tibialis anterior, the peroneus teres, and the contraction is eccentric.
Three, two,